The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum. Assalamu alaikum to all the listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all have a nice and positive week so far, and looking forward for a nice and relaxing weekend. This program is broadcasting live from the studios of Inspire FM on Thursday, 21st of November 2019. And casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden, Bedford. Our positive airwaves going all across UK as well, and reaching all the listeners who are listening us using Inspire FM app or our website, or you can also view us by our Facebook app, Facebook link, which is live link. So all you have to do is just go to the Inspire FM Facebook page and click the live link. If you are listening to the show or watching this show on Sunday or any other Thursday, that means it's repeat. Well, you can only listen. You cannot watch any other day except today, which we are live now. Unless you're watching rerun. Anyways, as we all know, we cover different health informative topics every single week. And today's topic is something different, something unique in many different ways. As we always say, is that prevention is better than cure, but we don't mean it because we don't take necessary precautions to prevent the disease. Well, today's show will definitely give you the necessary awareness of what it can go wrong if we do not take proper measures. Yes, we are. Today's topic is about pressure ulcer awareness. Yes, indeed, you have heard me correctly. We will be talking about pressure ulcers, and we are giving you necessary awareness of what it is and how we can prevent certain problems, and how can we look after our loved ones, especially who are not so well. And as always, I'm not the one who will be explaining about this. I'm on the other side getting the necessary education just like all of us. So luckily, I have a house full of guests today. I'm surrounded with nice, lovely people with me who will be giving us information about pressure ulcers and give us necessary awareness of what it is and how we can prevent certain things. So on this note, let me welcome our guest for tonight. So joining me today in the studios are the three ladies. So let's start with our very first lady. On my right, it's Gill Grant. She is the patient safety nurse from Bedfordshire CCG. After that, it's Ruth, who's the tissue viability nurse, and also we have Catherine, who's the specialist dietitian at the Cambridgeshire Community Services. Good evening, ladies.
Good evening.
How are you today?
Well, thank you.
So let's start with Gill. And Gill, if you give us a quick intro about yourself, and then we will move on.
Yes, First of all, thank you, Fahad, for inviting us on the show to raise awareness about pressure ulcers to the community. My name's Gill Grant and I work at Bedfordshire Clinical Commissioning Group as a patient safety project nurse. So looking at the quality of care that's being delivered across our nursing homes, domiciliary care and hospitals and community. And today is Worldwide Stop the Pressure Day, so it's global awareness where we're raising or making you more aware, the public, professionals and politicians aware of pressure ulcers and the life-changing event it can actually lead to. What we do know in this country as well, we're spending £3.8 million daily on pressure ulcers, and we know with certain small changes that we can reduce the incidence of pressure ulcers occurring, maintaining the quality of life of the person, but also saving some money from the NHS budget.
Indeed.
So, yes.
So let me introduce our other listeners as well, so other guests as well. So Ruth, if you give us a quick update about yourself and what you do, and then I'll move to Kathy as well.
Hello, my name's Ruth Mullins. I'm the tissue viability nurse for Bedfordshire Community Health Services. I cover central beds. There's two other tissue viability nurses, one working in Dunstable and the other one working in Bedford. So we cover district nurses, practice nurses, nursing homes and residential homes. And we also provide training to raise awareness of pressure ulcers within the community setting.
And Kath?
Hiya, my name's Katie. I'm a dietitian working for Bedfordshire Community Health Services. I do a lot of work with care homes predominantly, but also GP surgeries, and work with Ruth, jointly delivering training, mostly to care homes, about how to prevent pressure ulcers and how to treat them.
And yes, definitely, this is a very, very unique topic itself. And as Jill was explaining earlier, and I rudely interrupted her and asked all other guests to introduce themselves as well. Sorry, Ruth, you were saying something about today's the Worldwide Stop the Pressure Day.
So yes, it's a global awareness where healthcare professionals across the world are raising awareness to their communities, as far as Australia, America,
It's worldwide.
And so there will be events going on. What we're doing in Bedfordshire next week is having an event, an awareness event at the Rufus Centre, which we've invited our domiciliary care colleagues, carers colleagues, residential home colleagues, nursing colleagues and nursing home colleagues to come and to join into that event, just to raise awareness. And it's quite an exciting programme that's been put on by Ruth and her team. And anyone's welcome, you know, so if there's a carer out there that would like to come, we would be very happy to see them. That's at the Rufus Centre at 12:30 till 5.
It's till 4 o'clock.
On Tuesday the 21st.
No, 26th.
26th. Today's the 21st.
It's happened all the time to me as well.
So that's what today's about, and that's why we're here today, just to raise awareness with the local community.
So Ruth, tell us about on that day, what's happening on that day?
So on the day we've actually got speakers. So we've got the continence team coming to discuss incontinence products, pads. We've got tissue viability. We're talking about moisture-associated skin damage, which is quite common when somebody has incontinence. We've got physios and occupational therapists talking about reducing the risk of limb contractures. So when patients are nursed in bed, sometimes their tendons shorten in their leg and they get contractures. So we're really trying to raise awareness of that. We've also got
The equipment, Millbrook.
Yeah, we've got the
coming.
equipment providers coming. We've got the dietitians. We've got podiatrists, and we've actually this year we've managed to get the wheelchair services involved.
Wow, so it's a complete holistic services.
It certainly is.
It's a place where people can go and get a wealth of knowledge and necessary support guidance, which for their loved ones, especially if they're going through a certain difficult times.
Yeah,
And it's a very exciting event, I think, isn't it?
and it's been very well attended for the last 2 years,
Yes.
hasn't it, Jill?
Yes.
Perfect. Okay, so definitely we will be looking forward for that one. And then you said it's next week Thursday.
Tuesday.
Tuesday, next week Tuesday. So let's involve our listeners as well. So listeners, if you have any questions or queries regarding pressure ulcers, please do get in touch with us by calling us on 01582 481822. I repeat, 01582 481822. Or you can send us text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. We do like to hear your stories. We do like to hear your experience as well as your questions regarding this particular topic, which is pressure ulcers. If you or one of your loved ones gone through this phase, or they had pressure ulcers, or you're not sure and you need some more advice or guidance, we have experts in the house who can give you necessary guidance in terms of what food we should eat and not, how we can help, or what necessary cares we need to take regarding skins, and also definitely what necessary helps available and how we can tap them on. But anyhow, let's go to the very major questions in terms of pressure ulcer. Is what is pressure ulcer? So Ruth, let me start with you first. What is pressure ulcer?
A pressure ulcer can sometimes be known as in the community as a pressure sore or a bed sore.
Mm-hmm.
Usually they're injuries to the skin and underlying tissues caused by constant pressure on the skin. So usually presents initially as a red mark over a bony prominence. So anywhere that's got a bone and the tissue's being squashed between a hard surface, a chair and your tissue, sometimes the first sign is a redness.
So when it happens, is it painful, not painful?
Sometimes it is painful. It depends. Sometimes if patients have reduced sensation, they can't actually feel the pain. Sometimes it presents as just a red area, an area that can feel warm, sometimes cool. There's some discoloration. And when you press that area, we call that the blanching test. So if you have a red area and you press it with your finger, and it goes white and then comes back to red, it's blanching, but it's first signs of pressure damage. If you press it and it stays red, then you would need to seek advice from a healthcare professional. Sometimes it's just an area that feels sore or itchy. On darker skins, it can sometimes look darker, purplish or bluish. And sometimes a patient just says, I've got a sore heel, and we can't see anything, and 2 days later they present with a red heel. Later signs are blistering and sometimes bruising, which we call suspected deep tissue injury. So that can happen over a bony area. So keeping a careful check really on the skin.
Okay. And I just have a couple of questions popped on my screen. One of the questions is, Islam, I have got a plant flaces. Please tell me if there's any cure. I've tried injections and massage, but it's still the same.
That's not pressure related.
All right, okay.
Yeah.
Plantar.
Yeah.
Yes, plantar.
Fasciitis.
Plantar fasciitis, yes.
Yes, that isn't pressure.
No, it's not pressure.
All right, okay. Okay, sorry.
It's not our field of expertise, so
All right,
it would
okay.
be wrong.
I'm so sorry about it. But yeah,
Sorry.
no problem. I will definitely find more about this one and update our listeners as well. So, in terms of the early signs, what will happen to the skin, basically?
When you've got sustained pressure, when you're sitting for long periods of time or laying in bed without moving, the skin and the underlying tissue, the blood supply is sometimes reduced, or the tissue doesn't have an adequate blood supply. So you can notice the redness. That's the early stages. Sometimes it's shear. So when a patient's in a chair and they're slipping downwards, the layers of the skin slide over one another, and you can get a shearing pressure damage. When patients are in bed and they're slipping down the bed, you can also get shearing, or when somebody's transferring from bed to a wheelchair or to a chair. So redness.
Mm-hmm. So is it really bad when somebody can see? How does it look?
Sometimes it's just an area of redness, but it can sometimes feel hard underneath. So when you're pressing that area, if there's any hardness, I would suggest that you seek advice from a medical professional, because we'll go into equipment later, but sometimes you need a healthcare professional just to check that area to make sure it isn't pressure, because then we need to put in preventative measures.
Mm-hmm.
That's the most important time of recognising when those early signs, because that's the time you can make a difference and stop the life-changing event that may happen if it isn't resolved at that point in time.
Mm-hmm.
So that's why we're really sort of keen for those early signs and symptoms to be recognised.
To react to the red.
Yeah. And I would say on behalf of my colleagues, they would rather go and see something that wasn't pressure damage, but someone thought it was pressure damage.
Definitely.
Than actually someone saying, oh, I'm not going to bother them, I don't want to be a nuisance. We would rather you say, please ask that question, is this okay?
And sometimes people are anxious about calling out a healthcare professional, but I would say, if in doubt, you call them out. So just to get them to check and make sure that everything's in place for that patient, so we have a good outcome.
Okay. In terms of the when you said the early signs of pressure damages are
redness.
Yeah.
Sometimes an area that's cool or hot. So on darker skins, when you can't really see redness, sometimes it's an area that's blue or purple. Anything that actually doesn't feel right. Sometimes it can just feel sore, it can feel hard. So any area when, if a relative's looking after their loved ones, if they notice when they're giving them a wash or going to the toilet, if they notice an area that actually just doesn't look right and it's over a bone, it's always wise just to press it and make sure that the blood's coming back through. It's going white and then it's coming red again. If it's red and it stays red, that's a category 1 pressure ulcer. Early signs of pressure damage.
And if it's darker skin, would it look like a bruise? Would you think
sometimes
that might be a bruise?
Yes. But usually always over a bone.
Yes.
Okay. And if it is on a meaty area, like a place where you don't like thighs or any other place as well?
On the thighs, it's probably unlikely to be pressure if it's kind of inner thighs, unless sometimes you can get pressure damage from being hoisted, but
or in between your knees if you're lying in
between your
bed.
knees, if your knees are making contact with each other, but usually over a bone.
Right. Okay. So it's usually over the bone, and it will show those signs.
Yes.
Okay. So that comes to the section of diet as well. So does how diet link to the pressure ulcer, Katie?
So the risk of developing a pressure ulcer can increase whether you're underweight or overweight. So maintaining a healthy weight and eating a balanced diet is a really key way to reduce the risk of developing a pressure ulcer. So someone who's overweight might be more at risk of getting a pressure ulcer. It could be because they're less mobile, but also because there's more weight pressing down onto the skin and onto that bone. But also someone who's underweight will have less natural padding around their bones, so the bone will be much, much closer to the skin, making it more at risk. And someone who's overweight and underweight may just have a diet that doesn't have enough vitamins and minerals in, which is what's helping the skin to heal. So that might be causing them to be more at risk of their skin breaking.
So is there any specific diet they should go with or they should take on?
So in terms of reducing your risk of getting a pressure ulcer, dehydration can be a really key factor in your skin becoming really dry, really fragile, and makes it easier for it to break. So it's really important that we aim for around 1.6 to 2 litres of fluids per day, which is roughly sort of 8 to 10 glasses.
8 to 10 glasses, wow.
Yeah, so sometimes that can seem like quite a lot. It could be anything, so it doesn't have to be water, so it could be your teas, coffee, milk, juice. It's just alcohol that doesn't count towards that, so any of your other fluids will count. If you're overweight, you could try losing a little bit of weight gradually to try and reduce the pressure that's on your skin and on your bone. If you have a pressure ulcer already, though, we wouldn't want you to restrict your diet too much while that pressure ulcer is healing, because we'd be really worried about you not getting enough energy and nutrients in. So simple things you could do if you're overweight would be cutting out sugar from hot drinks and maybe using sweeteners, using lower fat cooking methods like grilling, snacks that are lower in energy like low fat yogurts, having meals that are balanced and trying not to miss meals, and aiming to lose no more than about 0.5 kilo to 1 kilo a week. Any more than that is quite a lot to be losing. If you're underweight, you might not have enough nutrient stores in your body, so we need to get some extra nutrition in. So to do that, you might need to make sure that you're having regular meals, whether that's ready meals if you're really struggling to be able to prepare things. Frozen and tinned vegetables are just as good as your fresh vegetables. Trying to have 3 small meals a day and 2 or 3 nourishing snacks during the day, like yogurts, cheese, nuts and biscuits, can help to build your weight up a little bit. And trying to include maybe some, we call them nourishing drinks, so drinks that are high in calories and protein, like milk, milkshakes, malted milk drinks and fruit juices.
Okay, a question just popped on my screen from one of the brothers. Says, does that include squashes?
Yep, in your fluids. Yep, absolutely. Squash would count. If you're looking to control your weight and your calorie intake, then a no added sugar squash would be better, but absolutely squash does count.
Wow, okay. So yeah, that's a bit exciting. So at least they can pretty much eat everything. So one of the problems is that whenever we say diet, so the first thing came in people's mind is that they will be cutting out all of these lovely things which they are very much fond to eat or drink, and it will become very plain and bland in many different ways. Anyhow, moving on. So in terms of what would make a person more at risk, and it's just Ruth?
So age is one of the risk factors. Patients, when they get older, relatives, they don't like to, they're maybe not as mobile as they used to be. So sitting for prolonged periods of time. And sometimes when you're on multiple medication, you know, I sometimes check patients' medication and they can be on a lot of medication now.
Is there some more tablets that might be more,
yes,
putting the patient more at risk?
So any blood thinners, warfarin, anything that thins your blood. There are certain tablets that affect your wound healing, which are steroids, and they can actually thin the skin.
And do the blood thinners actually make a bruise become more apparent? Is that what happens with the blood thinner?
It can do. When you get older and you lose the fatty padding underneath your skin, you often see patients with bruising on their arms. So blood thinners can, cause you to bruise more frequently.
So people who already on that kind of medications, if they think that they have pressure ulcers, how do they know?
Well, just keeping a close eye on your bony prominences to make sure you're not developing any red areas, as I said.
Rule of thumb is that all those areas which is pretty much like bony areas, you have to make sure that that's one of the areas of...
I think with blood thinners, it's more likely that you actually get bruising on your arms. You see that an awful lot, and on your legs. If you knock yourself, you bruise more easily. Pressure is mainly over a bony prominence. As Katie said, dehydration. Because you're losing the elasticity in your skin. It can be sweating. It makes the skin moist and more prone to breaking down. illness. You know what it's like when you're ill. You don't want to move. You lay in the same position in bed, and a lot of people say, just leave me alone, but you're actually laying in the same position for a long time.
And it's hard for families then to move somebody,
It's very hard. You know, we all know that when we're ill, we just want to be left alone. We want to lay in bed and not be disturbed. It can be being in bed following surgery. If you've had hip surgery, you're higher risk of pressure damage, any kind of surgery. As Katie said, obesity and also low body weight. Patients with reduced sensation. So we have some patients with paraplegia. They've had spinal injuries. So patients that actually can't feel that they're developing any red areas or any soreness. Poor diet, as Katie said, that we all need fuel to keep us going.
Indeed.
And medical conditions. Sometimes when you've got heart or circulation problems, they can affect the blood flow to your lower legs. So the risk of heel pressure damage. We always think of pressure damage being on our bottoms where we're sitting, but actually we get quite a lot of pressure damage on patients' heels.
On that note, I have to give you a stop on that time, unfortunately, because wow, the time has passed really quickly. We are approaching really close to our break. So when we come back from break, we will talk a bit more about where on the bodies you will see all those pressure signs. We will ask them more about what sort of diet we can have, especially in terms of section and so forth, and what are the tips to spot those things. These and many more just after these breaks.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I welcome you all to another exciting edition of Health and Fitness Show. I'm your host Fahad Matin for today's evening, and we are talking about pressure ulcer and its awareness with our guest Gill, Ruth and Katie. This program is broadcasting live today from the studios of Inspire FM, today on 21st of November 2019, and it's broadcasting live for our lovely people in Luton and the surrounding areas of Luton. And you can also hear us and view us on Facebook Live and through our website. So let me go to our guest and I'll ask them to reintroduce themselves so at least everybody knows who we have in the studio today. So let's start with you, Gill.
Hello, yes, I'm Gill Grant. I work for Bedfordshire Clinical Commissioning Group as a patient safety project nurse.
Hello, I'm Ruth Mullins. I'm a community tissue viability nurse working for Bedfordshire Community Health Services.
Perfect.
Hi, I'm Katie. I'm a dietitian working for Bedfordshire Community Health Services.
Perfect. And I'm so sorry, Katie. I've mispronounced your name earlier as well. And when I was reintroducing you, I forgot. So it happens. This is the perks of having a live video.
I won't be offended.
It's having a live video. So before we went on break, we were talking about certain... in terms of diets, and then we talked about how people can who are on risk and how they can and say what things can they do and how they can identify who are at risk and so forth. I did got some of the questions before the messages as well. Questions via messages before in the first half of the show. One of the questions were about plantar
Fasciitis.
Fasciitis. Sorry, you said you can explain about it.
It's usually pain on the bottom of your foot, around the heel and the arch of your foot. If you've had treatment and it's not working, then it's better to go back to see the GP just to get a second opinion.
Indeed, and although there are different treatments and things available, but yeah, the first port of call is,
I think if it's not improving, to go back and see your GP.
Definitely.
And get a second opinion.
Indeed. Anyhow, before we went on break, you were talking about what would make a person more at risk. But then, in terms of old people, when I say old people, means people who are in their late stages of their ages side. They sometimes they are very skin and bones all the time. So how we can identify whether they are on risk at risk for that as well?
Well, I think it all depends. You do get some patients that haven't got a lot of body fat, but actually they can be quite mobile. Whereas we could get patients that actually have a high amount of body fat, but they're actually not moving. So it's all on an individual basis. Obviously, if you've got a relative that is quite thin and they're not actually moving, then it is going to increase the risk of pressure damage if they're sitting for long periods of time. And also, if they're laying in bed in the same position, that would increase their risk as well.
Okay. Ruth, Jill, in terms of the pressure ulcers, how it changes your life if you end up having a pressure ulcer?
It's an extreme life-changing event, and often the public think pressure ulcers can't be very much. It's not sort of a high-profile illness, but the life-changing can be that the person feels very isolated. The family can feel isolated as well. There's all of a sudden a strict regime for turning somebody, moving them, rather than trying, if you notice it beforehand, you can prevent all this from going on. There's a great risk of infection to pressure ulcers and the high risk of sepsis. And the pressure ulcer actually takes control of your life.
Indeed.
So you're just living. Sometimes, people might be stuck in their bedroom because they've got to be nursed in bed, and they're just four walls, and that's their world for that moment in time.
It can make you very depressed, can't it, Jill?
It can go on for months, and sometimes they never heal. Sometimes you've got to live with it and make the most of the quality of life that you can. But if somebody, out there can just notice those first small changes, it can make a big difference to somebody's quality of life. It's life-changing to see those first signs, and life-changing if you don't see them.
So pressure ulcers and bed sores are one and same, right?
Same thing, yes. But as Ruth said, it doesn't always happen when you're in bed. It can happen in the chair, wheelchairs. Also, it can go on to lead to further surgical procedures, because they may need to be...
they may become infected. So we do have patients. Some patients need special pumps to heal the pressure ulcers. So it can be very debilitating for the patient and their families. It affects their families. They can't take their loved ones out as much as they used to because they're actually being nursed in bed. So it actually, not only does it affect the patient, it can affect their families as well.
And what we haven't really said is a pressure ulcer can let off an odour.
Yes, it can.
Which is the isolating factor. That person that has the pressure ulcer doesn't want to go out and mix with people because they can smell the pressure ulcer on themselves. They can smell that wound, and they would be, certain that other people could. So that isolation then, as Ruth has said, leads to depression. If it's somebody that's working, they don't go to work, and it leads to a vicious circle of very hard to sort of get out of, and to start thinking about having a normal life at the end of this journey. And, quite often patients think it's the worst thing that could have happened to them. If only I'd known.
Indeed.
And that's the thing. If only I'd known.
And that's why we're really here to educate families and to make sure that, you know, they do keep and encourage their family members to keep moving, to look for any red areas, and to make sure that if they are concerned that they contact an appropriate healthcare professional for advice and support. And there's lots of support out there in the community.
So have you guys witnessed or is there any examples you can share where a patient or their loved ones were not aware that it's a pressure ulcer and they find out later on?
I think sometimes when patients have wounds, and I can think of a patient, actually, he was going to work, he was only in his 40s, and he was paraplegic, and he had 2 category 4 pressure ulcers, were actually right down to the bone, and he didn't realise, because he was independent, washing himself, showering himself, taking himself off to work, realised he'd got a wound, but actually didn't realise the depth.
Was a pressure ulcer?
Yeah, the depth of the wound.
Wow.
He ended up in hospital, and they did heal eventually, and he went back to work. So it was a happy story. But there are patients when you're living on your own and you haven't got anyone to check for you, and you can't feel pain. It is a worry that there's probably patients out there now with pressure ulcers that nurses don't know about.
So in terms of some people who sit quite a lot due to their illness, do they develop sometimes sores in the back and the bottom areas? So is that a pressure ulcer as well, or
Yes.
is that linked to the pressure ulcer?
Yeah, it can be sometimes when people are sweating or they're incontinent of urine. You can get a moist area around the buttocks, but once the skin is broken, it's always high risk then of pressure damage. We have in the community, it's quite common now that patients that live on their own, they maybe have carers at 8 o'clock in the morning, and then they're sitting till 12 o'clock at lunchtime without actually moving, waiting for the in between carers visits. So those patients are always going to be high risk of pressure damage because they're not able to get up on their own and relieve the pressure on their bottoms.
So for these people, what are the best things they can do?
Well, we always say that if they can rock from side to side in the chair, if it's safe to do so. So we have to look at the risk. If patients have got dementia, are they safe to actually do that? We would get an occupational therapist out just to check. So just to encourage, if people can stand at least every hour and try and mobilise as much as possible to prevent the sustained pressure on their bottoms.
No, thank you so much for that, because last time when I had this show, I was thinking that yes, people may have it, but it has helped me as in person as well to look after my mom, and it's something which we thought about it that she might be developing a pressure ulcer, which did help a lot because we highlighted it and it got resolved in a very early stage, so it did not manage to go on beyond the line. So yeah, it is what it is. Katie, in terms of the dietary sections, so what dietary advice will you like to give for people who have these kind of pressure ulcers, and then because they are not very much moving, is there any specific diet they can take, especially if they're like vegans or if they're diabetics?
So when someone's got a pressure ulcer, then things like your protein and vitamins and minerals are really important in healing that pressure ulcer. So your body needs the energy, the protein, the vitamins and the minerals to heal that skin. So the one thing that can be a little bit trickier is if you are a vegetarian or a vegan, sometimes people can struggle to think of sources of protein. A lot of the time people just think protein, meat, and especially if you're following a vegan diet and you might not be having cheese or milk or things like that, people can get a little bit stuck about how to get that protein in, and the protein is really important. So you can have lots and lots of non-meat sources of protein, your beans, lentils, tofu, soya, nuts. So you could have chickpeas or lentils in a curry or stew. There's lots of different ways of getting them into your diet, and it's really important to make sure that you're having a source of protein at every meal. It's also important to make sure that you're having a balanced diet, so you're getting all the vitamins and minerals. So there's loads of information about a balanced diet on places like the NHS Choices website. And if you're particularly vegetarian or vegan, the Vegetarian and Vegan Societies have some really useful information if you wanted to look a bit more specifically about how to get that protein in.
Mm-hmm. Mm-hmm. Sorry, I just got a message on my screen from one of the listeners. By the way, listeners, if you have any questions or queries regarding pressure ulcers, please get in touch with us. And if you like to ask any questions to us, you can call us on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. So I just got a message from one of the listeners asking if a loved one had pressure. So while in hospital, what can we do?
If they're under the care, if they're actually in hospital,
Yes.
well, they should be under. They'll be under the care of the nurses on the ward, who would be aware of the pressure ulcer. So they should be repositioning the patient, using the appropriate dressing, and also they have got their own tissue viability nurses in hospital. So if the ward nurses were concerned, they can get specialist advice from the hospital tissue viability nurse.
Mm-hmm. So in terms of the ones who... So what should one do if or if someone is caring for you? So for the people like carers especially, they normally see their loved ones day in, day out, especially when they are sitting there or lying down. And sometimes, yes, you know that, yes, they need to move or take them bath or so forth. But all of a sudden they see a very awkward patch on the skin. What is the best thing to do at that time?
The best thing to do, that if you're worried about any red area or any skin changes over a bony prominence, is to contact one of the healthcare professionals. So contact the district nursing service. They will come out, they will do an assessment, they will check if it's pressure damage or not. Mm-hmm. They will be able to give you advice. If it is a pressure ulcer and it needs dressing, then the patient would be under the care of the district nursing service. Mm-hmm. And also, they may need specialist equipment. They may need pressure relieving or reducing mattresses or cushions. Mm-hmm. So if in doubt, I would definitely call the district nurses out to just check the red area or a wound if they notice one.
Okay. And in terms of those areas which is not very much bony prevalences, but then they are the hidden areas like armpits or person's bottoms or inner thighs areas near the underneath the what do you call, knee area, and underneath the knee area side.
If you don't think it's pressure damage, then you can also ask your GP to check. But if it's over a bone, it's red, it's highly likely to be pressure damage.
And if it's not in the bone area?
If it's not on a bone, it can be sometimes fungal infections underneath the armpits. Mm-hmm. So it's always worth contacting a healthcare professional to come and check.
Okay. And district nurses can able to guide them as well?
District nurses are trained. They see a lot of patients with pressure ulcers, so they are the ideal person just to check to make sure it's not pressure, mm-hmm. or confirm it is a pressure ulcer, to give the patient and the family advice and support, and check that all the appropriate equipment is in place and all the appropriate healthcare professionals like KT dietitians, mm-hmm. could be they need physio or OT, occupational therapy, just to make sure we all work as one big team. Mm-hmm. Podiatry as well, if there's any problems with the feet, if there's mm-hmm. a pressure ulcer on the heel, we involve everybody and we all work as one big team.
Okay. And how do we know that it's a pressure ulcer and not the other thing which one of the listeners asked earlier?
Normally, said pressure ulcer is over a bony prominence, mm-hmm. and you would press it. If there's a red area, you would do the blanching test. You would put your finger over the red area, mm-hmm. press it, let go. It should go white and then it will go back to red. If it's red and it stays red, that's early signs of pressure damage. But any red marks, even if it's blanching, you need to be assessing those areas every day, because high risk of deterioration. As Jill said, we don't want it to turn into an ulcer, which can actually be life-changing for the patient. What do you think, Jill?
Yeah, and sometimes what we do see, which is very sad, that the nurse has been in and ordered equipment, and the patient then or the family think, actually, we don't want to use the equipment, and then the nurse is called back perhaps 3 or 4 weeks later because there's a grade 2 or 3 category 2 or 3 pressure ulcer there that could have been prevented because the equipment was there to be used. So what we would say, if equipment has been ordered, it's done by the assessment of the healthcare professional, and it's required to prevent. And that's always the key word is prevent these pressure ulcers developing.
In terms of in terms of the pressure ulcers categories which Ruth just mentioned, Jill just mentioned, how many categories are there? I'm a bit kind of intrigued to know.
There's 4 categories of pressure ulcers.
And how do we know which is which?
We actually have got some leaflets here that one of the matrons has done with pictures on them that guide families. They're information sheets for families and carers. So category 1 would be an area, as I said, of non-blanching redness, so red area. Category 4 is usually when you can see exposed bone, so as deep as it can go.
Oh, okay. So category 4 is when you can see the bone.
It's very serious.
Yes.
What about if someone's got a scab? What do you think a scab would indicate on a bony prominence with an at-risk patient?
Pressure damage.
Yeah.
We do see scabs quite often on patients' heels. With a diabetic patient, you've got to be really vigilant because any wound on the foot, sometimes they have a reduced blood supply. If their blood sugars are not within a normal range, we would always refer those patients with high-risk feet to podiatry and let them have a look. And also we have got the diabetic foot clinics in Luton and Dunstable Hospital and Bedford Hospital as well. So again, we work closely with the podiatrists.
And they are, and definitely, if there's any signs and symptoms of pressure ulcers, please get in touch with your health professionals, your GPs, your nurses, practice nurses, and if your loved one is under the care of district nurses, please get them involved, get them sorted. See it, say it, sorted. In a way. Sorry, one of the questions just popped up on my screen. Says, "Great show. Does the tight cloth make any difference?"
Yes, it does. Yeah. So if you've got tight clothing, it's going to restrict the blood supply. So to make sure that clothing is loose and comfortable.
And if you're
paraplegic, you can see sometimes
in the groins, haven't we? Where young people have wanted to wear tight clothes.
Yes. So, if you're young and you're wearing tight-fitting clothes and you're mobile, that's fine. But I think when you're sitting for long periods of time and you've got really tight clothes on, they can actually cause marks to the skin, which then can impact onto your pressure areas.
One of the things we didn't talk about as well is the care of the skin when someone's being washed.
Yes.
People like perfume soaps and nice soaps, but that's actually, am I right in saying, Ruth, the worst thing that we could be using on the skin?
We always say, really, if somebody's got any moisture damage or soreness, the best thing to do is just use plain water. And if the skin's broken, they're going to need a barrier product, so a barrier cream, which just protects the skin.
So not talcum powder?
Not talcum powder, because talcum powder can end up going into quite little hard balls of chalk.
Will it make the skin very dry and more?
It can make the skin dry.
Yes.
I mean, I know a lot of people like using talcum powder, but we do try and discourage it now.
So things like the proper moisturising cream like E45 or something like that.
Yes, but
it's normally need to be prescribed by a GP or a clinician, right?
It does. But GPs now are encouraging patients to, if they can afford to buy the moisturising products, to buy them themselves. If a patient has got moisture lesions from incontinence, they would need a prescribed barrier cream. So it would be best to see the GP. If they have moisture lesions, see the practice nurse or call the district nurse if they're housebound.
Okay, cool. In terms of the meals itself, Katie, can you please recommend a meal replacement or a supplement for these kind of patients?
So we quite often get asked about kind of vitamin and mineral supplements and if they are useful for people with pressure ulcers. Generally, we would say that if you're having a varied, balanced diet, then things like that aren't necessary. You can usually get the vitamins and minerals that you need from a balanced diet. If you're really struggling with a balanced diet and you have a poor appetite, then potentially one of the sort of A to Z type vitamin and mineral supplements might be useful, and you can get those from lots of different chemists and supermarkets and things. But there isn't generally necessarily a benefit to them if you're having a balanced diet.
Right, okay. So, but then people who are in their late ages or being completely bedbound, they don't like to eat much. Unfortunately, this is one of the very awkward things. But anyhow, oh wow, we are literally extremely short of time. We are almost approaching to the end of the show. So can I ask you all to give a quick tips on how to spot the risk and how to look after the pressure ulcers? Let's start with you in terms of diet. What do you reckon, Katie?
So from a diet perspective, the main things would be making sure you're well hydrated. If you're overweight, then maybe looking at losing a little bit of weight. And if you're particularly underweight, looking at trying to increase your calories to maybe put on a little bit of weight and a bit of padding. If you need some resources, then just search for Food First Luton, and there's loads on there.
Perfect. Ruth?
Try and keep as mobile as possible. Encourage your relatives and loved ones to move as much as possible. If they're in bed, try and encourage them to move in bed. If you're in any doubt and you're worried about any red areas and you feel that it could be pressure related, then you have got your local Luton District Nursing Service, and also in Bedford and Central Beds we've also got the single point of access, which you can Google. So if you need any input or advice from the district nurses in Luton, you can Google it and the number is available for you.
Okay, perfect. Thank you so much. Jill, very quick second.
Just to say, in Bedfordshire there's a lot of training being offered to people that actually look after people. So,
okay,
assurance.
Perfect. Thank you so much for all your help, and thank you so much for coming today. That's all for the show today. Thank you. Bye-bye.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.